Raja. Mana?
Hi.
I can see that. So I need to mute my computer so that
Can you hear me? Yeah, Murna, can you hear me? Good morning.
Good morning. Can you hear you, sir?
Yeah, I can hear you very well.
You're all welcome.
Thank you.
All right. Yeah. Okay, let's give like 2 more minutes so that other participants can join. I can see some people trying to join me.
That's all right by me.
Hello, everyone. We're waiting for 2 more panelists. Just give them 3 more minutes before we begin. Thank you. Hello, everybody. Sorry about the delay. So we have 5 panelists here. We're waiting for one more person, but I think we'll go ahead.
That's all right.
All right. So thank you everyone for joining me. My name is Murna Akyok, and I'll be the moderator for this webinar. Before we comment some few ground rules, please endeavor to mute your microphones if you're not speaking. You can also use the chat forum to make comments and ask questions, and also use the raise hand option when we give opportunities for people to ask questions or make comments. So, as we all know, our topic for today is life after rape. And we're trying to see how the survivors, we're going to talk about the survivors' rights, care, support, and justice. To discuss this, we have selected some great professionals across various disciplines and various organizations to debunk this topic. We have Dr. Salmah Abdulhamid from INET Clinic. We have Mrs. Evangeline Dan-Yusuf from She Nation. She's the convener of the She Nation Foundation. We have Mr. Arinze Oraku from NAFTI. We have Mr. Kennedy Shaiyen, a psychologist from the University of Jos. We have Jade, Barrister Jade. And finally, we have Comfort Ago, who is part of the Girls Get Equal activist group. We'll first begin by thanking Plan International for this opportunity to use their platform to discuss such important issues that are going on in the country and globally right now. So we'll start right away.
Yeah, Murna, you can hear me?
Yes, I can hear you.
Well, my video isn't displaying.
Okay, no problem. That's fine. You can go ahead.
Okay.
So, in Nigeria, about 30% of women and girls across 15 to 49 years are reported to have experienced sexual abuse. As the country declares a state of emergency against such
Sorry,
forms.
I can't hear you.
Hi, Dr. Salmah, can you please mute your mic?
Muted? Okay.
All right, thank you. So, as the country declares a state of emergency against such violence, it does so in the face of various systemic challenges, entrenched gender discrimination, discriminatory norms, and increases incidents as a result of the measures adopted in accordance to national strategies. So we would like to discuss some of the issues surrounding rape in Nigeria right now. And like I said earlier, we will discuss with some of the professionals we have across board. So we have Mr. Arinze online. Mr. Arinze, can you hear me?
Yeah, I can hear you, Murna. Can you hear me?
Yes, I can hear you.
Okay.
So recently we've heard cases of justice for Tina, justice for Uwa, due to the trends all around concerning rape. Can you define what rape means based on the Nigerian law or Nigerian system?
Rape is a gross violation. It's a gross assault of the integrity, the chastity of any human being by another. Just because of using physical means to assault this individual and cause a penetration.
Hello, we can hear you.
Of this person's orifice is what rape is. It is an abuse. Can you hear me now? Yes, so I said it's a gross violation, it's a criminal abuse, it's an assault, of an individual, because I don't want to make it a gender thing, by another, to cause a penetration of that person's, abuse of the sexuality of an individual by another criminally, just because of, using strength without any consideration, the chastity and the peace of this person is violated by this. In simplicity, this is what rape is. I can actually go forward and get a paper and read out to you the way the Supreme Court of Nigeria did define rape.
Okay, so from what you've said now, we understand that rape is actually a criminal act. So what are the provisions made available for people that have been raped in Nigeria, coming from your office?
In the minimum, the minimum sentencing regime as applies to violence against persons at least 14 years. But since the fact NAPTIP was made to be the enforcer of Violence Against Persons Act, we've actually recorded the last conviction we got for it for life imprisonment, of a man that abused his sister of the wife that is living with them for the past 4 years. So he got a life imprisonment. Right now, but you see, the thing is that we're not as concerned as in the penalties that people get, that as much as we are concerned from a society that is even prepared to protect its girl child. There are different structures that the agency has called that states, local government must provide.
Hello, Mr. Arinze.
Girl child. Child Rights Act is still in their states. If we don't have this wasting time, because at the point in this country, there was armed where people were being shot on the street. Hello, can you hear me?
Yes, I hear you.
Hello, can you hear me now?
Yes, I hear you, sir.
I can't hear you. I think I've lost you.
Hello.
Okay, let me get back into this thing. Let me try and launch myself back and see whether it will be okay. If you can.
Okay. Thank you. All right. While we wait for Mr. Arinze to join in, I'll move to Dr. Salmah Abdulhamid. Can you hear me, Dr. Salmah?
Yes, I can hear you.
All right, thank you. So, on your part, how does rape physiologically or physically affect the victim?
Well, you see, before going into that, so I would want to define what rape is from the medical standpoint. You see, from the medical standpoint, we defined rape as a non-consensual penetration of the vagina, the mouth, or the anus, either by the penis, any other part of the body, or using another instrument. So women that face rape, women that go through this heinous act, they face a lot of things, and they face a lot of damages. Some of the damages are physical, some are mental, and some affect their social well-being. So, hello?
Yeah, we can hear you.
Okay. So the physical aspect is that which you can see, because some of the effects are immediate, some of them are long-term, and some of them are even hidden. You don't get to realize them till after a while. So the physical ones are the ones you can get to see, like when a woman is raped, you can see the injuries she incurs on the private area. There is the risk of unwanted pregnancies. You have the complications that come with the pregnancy. You have the risk of sexual transmitted infections, HIV, and urinary tract infections. Then when you go to the mental aspect of it, there are conditions like anxiety, depression, post-traumatic stress disorders, and then you have women having suicidal behaviors, sleep disturbances, some people going into substance abuse, and so on and so forth. Then even there are individuals that come out of it without facing any of these challenges, and then yet again they face something from the society, which is the stigmatization and the rejection. So this is the social impact of rape on the women. So it's you have them getting rejected from their families, from their community, and then they have to live with that stigma and blame.
All right. Thank you very much, Dr. Salmah. Let's move to Mrs. Evangeline. As a psychologist, how does rape psychologically affect the victim? We've heard the physical parts from Dr. Salmah.
Okay. Rape actually has like a very, very serious psychological effect on the victim. And one of some of the things the other speaker has already mentioned, Dr. Salmah, anxiety, PTSD, depression, but there are other psychological like effects. So for instance, the victims can start to feel like they're to blame. It was their fault that they were raped. The victims may begin to feel panic attacks. They may begin to have like hyperventilations, panics. They begin to have trust issues wherever, and then they begin to have like flashbacks of the incidents that caused like extreme stress. They have nightmares. Sometimes they feel scared, they are ashamed, they feel alone. Some of the long-term effects of rape for the victims are like the inability to ever be intimate with another person, you know, again, even if it's legitimate, like in the case of marriage, they are usually not very open to trusting other people. They're not open to new relationships. They begin to like blame themselves and question their ability to make judgments, you know, asking questions like, should I have known? Was I too trusting? Did I give a sign? Did I make myself too available? You know, things like that. So they begin to, one of our very, very serious side effects is it begins to diminish their self-worth. So I have interacted with a few victims, and one of the things that is always reoccurring is they don't feel beautiful again or handsome. They don't feel like they are worth living, and that's where it graduates into like suicidal tendencies. You know, their sense of worth and esteem drops drastically, and it is enabled by the shaming culture that we have for people who are raped, and the stigma associated with it. So it actually really affects them mentally. They cannot concentrate at work. They cannot concentrate at home. They become irritable. Some people go through different extremes. So you have people who
Hello. Okay, we've lost Mrs. Evangeline. All right, she had listed a lot of psychological impacts that rape can cause to individuals. We'll move to Mr. Kennedy Shaiyen. So we've seen a lot of impact or how rape affects victims. How effective is therapy or counseling for victims? And how long can recovery last for this kind of victims?
Okay.
Sorry, hello, can you hear me?
Okay.
Okay, yeah, I can hear you now.
Do you remember the last thing I said?
If you repeat yourself, you'll be glad so that we'll show you.
Okay, so very briefly, I'll just repeat myself. I said that it has like tremendous like psychological effect, and Dr. Salmah has mentioned like some of them, but some other traumatic experiences is the feeling of extreme fear, the feeling of extreme shame. Some of these victims have flashbacks of the incident, so they could be sitting down in a normal like environment and just respond to a particular trigger. So triggers can be like in different forms. Triggers can be in the smell of a place. Maybe the smell of the place reminds them of the place of the incident, a perfume, a color, the shape of a person from the distance that reminds them of the incident, the time of the day, the hour of the day, whether it was like 12 o'clock in the afternoon. So every 12 o'clock, they have like serious, like traumatic experiences. So their triggers could be everywhere. If somebody comes close to them to give them a handshake or a hug, it could cause like triggers that cause extremely stressful, like situations. They can have nightmares, they have feelings of being unsafe, they have trust issues with themselves and with other people. One of the things that I have personally noticed is that these victims begin to question their sense of judgment, maybe start blaming themselves for the incidents, asking questions like, should I have known? Should I have seen it coming? Is this something I said? Is this something I did? These are questions that victims like ask themselves. And one of the things that is very, very common among women victims are where they begin to, their self-esteem and self-worth drops drastically. And, you know, they don't feel worthy. They don't feel like they should have been alive. Maybe if they were dead, it wouldn't have happened. Things like that that cause suicidal thoughts and tendencies. So many of these things actually happen, but like, it's just the mind, you know, because this is actually a very, very like terrible traumatic experience. And some of the ways to like rationalize it, to make sense to you about why it happened to you, is some of these false assumptions that some of these victims make. But I would just mention here that it also like leads the victims towards two like extremes. So you can either have an extreme where they become very, very reserved and utterly like closed off to everyone. I've actually experienced a case where the victim actually became mute, like stopped talking at all. And then we have cases where the victim become just sexually promiscuous, just goes to the other extreme. So these are some of the challenges that are caused by the trauma of rape for the victim. Yeah.
Wow, thank you very much. That was very elaborate. I picked that there are so many triggers for rape victims.
Yeah.
And
Yeah.
thank you very much. So, Mr. Kennedy Shaiyen, I was asking earlier how effective therapy can be for this kind of victims, seeing the kind of psychological trauma they usually face after such assault. Mr. Kennedy.
I don't think he's online.
All right, Eva, would you like to take us through that as well?
If I get your question right, is some of the things that can be done, or?
Yeah, if therapy is actually effective based on all the triggers we called out and the whole psychological effects that such individuals face.
Okay, I, as a psychologist, I know like the effects of therapy, and I must say this, that therapeutic like solutions do not always have to be done by a psychologist. Is preferred if it's done by psychologists because of their trainings. But in our Nigerian terrain, it has been noticed that a lot of Nigerians would rather see a spiritual advisor, rather see a person of faith, or a traditional like leader or a trusted family member, rather than seeing a psychologist, just because of certain like stigmas that's attached to it. So like if you are seen going for therapy, the assumption, the not educated assumption is that you are either going mental or something's wrong with you. That's why you have to go to therapy. So a lot of people would rather see religious leaders, traditional leaders for solutions. So I think that therapy can really, really work. First of all, like most of the effects, aside the physical like battles you fight, are battles of your mind. And what a therapist does for you is help you sort through, not escape, but help you sort through like the emotions you're going through the events that has happened, and just so that you can deal with it and walk through it and come out better on the other side. There's no escaping what has happened. The only way to through healing is to go through the event and then to go through it with someone to help you and tell you the truth along the way. So some of these like assumptions, as I mentioned earlier, by these victims are false and they are untrue, right? And they don't know that they are false and untrue. And it helps them, like a therapist helps them walk through it and know that these things are false and untrue. So therapy actually works. There are like recommended things that people can do to help them. And yeah, but like I said, if therapy can be done, but if taught properly, therapy can be done by all these other like mental health like caregivers from all over, but preferably a psychologist because they are properly trained, or a mental health specialist because they are properly trained to handle like situations like this.
All right. Thank you very much, Eva, for highlighting.
Hello, Mona. Can I jump in here?
Yes, you can go ahead, sir.
Yeah, you see, kudos to what the last speaker said, but I think therapy also can be in layers. Why do I mean and why do I say it? The very first thing an abused, a violated ones is justice. The emotional trauma and all those things. But unfortunately, we live in a society like ours where premiums are not placed on such things. She has spoken very well. There's an emotional and psychological things and mental health issue that will be dealt with. But you see, when the animal is left and is walking about as if nothing happened, strutting about, when the law enforcement persons that are supposed to protect the victim, protect the abuse, make sure that he gets justice, then there's an emptiness in the therapy that comes, because however you console him, and we also have a society that, forced closure on such issues. Closure will not come by stigmatizing the victim. What did you go there to do? Why were you wearing what were you wearing? What you were wearing? Why were you at a place where you're not supposed to be? So these are the things that actually militate against therapy, and they deepen the pain and the frustration of this particular individual. So for me, the very first thing to be done on an issue like this is justice. To begin to look again. We've drawn up there's no national template for trauma response. A rape this year still remains a rape in 2004, whatever. A rape is a rape. Okay, so you cannot tell a rape victim, why didn't you report that time? Why did you? It is not something anybody wants to live with. So we need to begin to change these our perceptions and understanding of what people go through. You can't be in somebody's mind to know how to deal with issues. So now we're asking them, please, as a rape victim, we understand how hard it is. Don't have your bath. Don't change your clothes. If the animal use wipes and condom, pick up those things and go straight to a medical hospital. Go to a hospital, report yourself to a doctor for an assessment, and let them give you a report before going to the police. Those things are credible materials that will be used in prosecuting the animal for the crime that he or she has done. So that's just what I want to add.
Okay, thank you very much for highlighting that part. All right, but we'll come back to, okay, while you are still on, let me just ask, someone is asking, how effective is data management process for gender-based violence, and how does it affect response process? You've said a lot about how victims do not want to go and all of that. A lot of data has been lost. For example, Nigeria has recorded 717 rape cases reported in 2020, but only 50 so far have been prosecuted. Where are the rest? Why is this the case in Nigeria now?
Beautiful. You see, the point that the responses are variegated in the sense that every institution, Ministry of Women Affairs, police, civil defense, NAPTIP, all of us are working against rape. There's no problem with that. But the clearinghouse should be the National Agency for the Prohibition of Trafficking, because they are the ones enforcing the violence against persons. But even at that, how many states have domesticated the Violence Against Persons Act? How many states have? If you don't have this, you can actually abuse the violation. Just entering justice is meaningless as much as it's pointless. So, for the ones that come to NAPTIP, they are here. We have a sexual offenders register, and it is up and running. If you're an offender, and we're asking Nigeria, shame is not the rest, that shouldn't be the portion of the victim. Shame is for the culprit. Shame is for the animal. That is the person to be stigmatized. And that's why we're keeping the sexual offenders register. So the response is, if all these agencies close down and work with NAPTIP, we can have a one-stop template, a one-stop reference point, a one-stop data that is collected for, has gone to see the Director General of the National Human Rights and the IG of Police, so that we can close ranks and begin to, rather than working at cross purposes or in diverse forms or in silos, we can actually close ranks and have one complete data collection center of all pedophiles, of all abusers, of all violators of women, of any sexual offenders.
Yeah, thank you, Mr. Arinde. I understand what you're doing now. Is Comfort online? All right. Kennedy, we see that you're back. Someone asked a question from the audience in the chat room. Why is rape on the increase right now? We see that it's been like there is a pandemic of rape cases. As much as COVID-19 is a pandemic, rape is now a pandemic. What's the cause of this exactly?
Well, it's funny that it's seen as a pandemic, but it's true. There's rise in rape cases, and it's even more painful that we have like infants who are even being raped. Like there's no excuse whatsoever for rape. There's no excuse whatsoever. But as for the reason of rape, well, okay, for instance, let's say in Nigeria, okay, science does not really believe in let's say diabolical reasons for rape. Science doesn't believe in that. But in Nigeria, we know that there are certain people that go into this for diabolical reasons. But then psychologically, there are some mental factors, psychological factors that could be the reasons for such as neurobiological impairments. like in the as such as maybe brain damage or maybe hit to the head could affect some parts of the brain that could lead to having sexual perversions. Other cases could be psychiatric disorders, such as schizophrenia, psychosis, could all lead to stuff like that. And then there's this other one also, paraphilia. DSM-4 sees paraphilia or defines it as at least a 6-month period of recurrent or intense sexual arousal. Now, it's not normal to have a person having sexual arousal for up to 6 months, for that long, and it's intense. It's almost impossible. Something has to be wrong somewhere in such a person. Or another case is cause of clinically significant distress or impairment in social or occupational and other important areas of the person's life. If a person is going through so much stress and doesn't know how to handle it, it could lead to such sexual behaviors. And then also we have issues like intimacy and attachment problems. Several studies have shown that rapists experience multiple early life adversities, such as rape. Some of these perpetrators are they themselves victims of rape or physical abuse while growing up, and then dysfunctional family relations, which are likely to affect the capabilities of secure attachment and developing healthy adult relationships. Sometimes these people grew up being abused they themselves, and they don't know anything other than that. And so they feel, well, that is how it's supposed to be. And then some others feel that, okay, maybe just want to show dominance, or they want to show power. They just want to oppress. All these are they're not normal. They're not normal, because a normal person would not just want to stand up and say, okay, I want to have sex with a child. I want to have sex with this lady, whether she agrees or not. It doesn't sound normal. And that's why I don't really blame Mr. Arinze for calling them animals. But then, it's even animals do not stoop so low as to raping other animals. So I think if I'm to borrow your word, they're actually below animals. But then there are some psychological effects, as I've mentioned a few. There are also cognitive distortions that could cause such things, where you have a situation where a man.
Hello. Okay, I think we've lost Kennedy. All right. This is Evangeline.
Murna, can I quickly jump in, because I heard them talk about excuses and reason.
Yes.
We should try and separate excuses and reason. There's no reason for crime, criminality. We can only make excuses, and those excuses are not tenable, and they are not allowed in law. You see, academics try to do is to find explanations to why people do what they do. But as far as the law is concerned, they are not the reasons. Reason is tenable. Excuses are finding a way to explain away our inadequacies and malcontent. So for something as devious, as horrible as rape, it's only left for those who study human psychology, psychologists, to try and deconstruct the mind of those people and see what is it and find explanation for their misconduct, but not that they are not reasons, they are only excuses.
Hello, are we together?
Thank you. Yes, Kennedy, he was just
okay.
Something that he said. So you have spoken about the things that would make one wants to rape. Do you think counseling works for this kind of people as well?
Yes, of course it does. So long as it's a psychological defect, it definitely works. But then these are not excuse for rape. It doesn't justify rape in any way. There is no excuse for rape. These are just psychological explanations as to why these things could probably occur. I don't think these things are not even admissible in law, except of course you can prove that this guy has psychosis, schizophrenia, or something. But these are not, I don't see them as a reason that you can say, okay, because I have this problem, I was raped as a child, so therefore there's an excuse for me to rape. It doesn't excuse rape. Rape is evil, rape is evil. We cannot give excuses for it. Sometimes we hear people say something like, she is dressed in hot pants and her cleavage is visible. That means that she wants sex and it's okay for me to have sex with her, whether she likes it or not. That doesn't really make sense.
Yeah.
It doesn't make sense. But then therapy actually works for people that actually have schizophrenia. They're abnormal. We don't call them mad. Mad is for, but then people with abnormal behavior who are clearly abnormal, there are therapies that work for them. Okay, for instance, now someone who had an abuseful childhood, if asked questions, you get to know why he behaves the way he does. And then therapy can help him overcome or come out of such mindset. So yes, therapy can work. Therapy can work because even if they're imprisoned or jailed or whatever, there's some sort of communication or some sort of questions. They're being asked questions of their background and all whatnot. That in itself is some sort of therapy or some sort of psychotherapy to try to know the reason why they behave the way they do. So, but then it doesn't really excuse rape.
Yeah. All right. Thank you very much. Propius.
Yeah.
Mr. Abbas Jimo of Daily Trust has a question. So we've been talking about how people who have been raped can get back on track. Can we have different approaches now, as previous interventions seem not to be working? Mrs. Evangeline, I see you're raising your hand. Can you start by answering or providing some solution to Mr. Abbas's question, and then you go ahead with your comment?
Okay. I'll try and do it the other way around so that it doesn't get lost in the conversation. I just want to make like 3 very short points. Mr. Kennedy has spoken like for the psychological like part, but I just want to say that all avenues contribute into the progress and the health of the individual. So justice is really important to their psyche and to their healing, as well as psychological interventions, because the case of what happened to the person, but there's also the person who was injured, you understand? So all avenues are actually really needed to see to the wholeness of the person again. There are other factors that contribute, you know, to this rape culture aside the other psychological. I think that sometimes culture aids this rape culture, right? Sometimes just the feeling of dominance, just the feeling of the excuse of it is my personality, this is how people are, being in a position of power and abusing that power can be used to, for rape. There was a question in the comment that says that it seems like rape is on the rise. I think that rape is now more reported than it used to be, not necessarily on the rise, because of the advent of social media and because of some of the interventions and organizations that are coming out to say, okay, we will protect you if you come out to speak. A lot more people are now coming out to say, this is what is happening. And as more parents are enlightened about what is really happening, they can now identify these things as sexual abuses. So for instance, rape in marriage, even though under the law, it may not, under the law in some certain states, is not considered as like possible, like rape in marriage can occur. Right now, it is considered, it's considered and is in some of the criminal like codes, you know, in some of the states. So it is now, is coming out more. That's why we're seeing it more. But it has been happening a lot, especially in the rural communities, on the underserved places. People are coming out more and people are identifying it more as not a normal thing. So people are speaking out and it is becoming more pronounced, okay? But rape has been in the culture for a very long time. And thankfully now we know how endemic it is and how important it is to deal with it on all fronts. And concerning the solutions to be made, I think that Mr. Arinze spoke about like the law equivalent of what can be done. I also think that people need to be educated on the law concerning like human rights and things to do. A lot of people have experiences, but a lot of people don't know what to do with their experiences. So people need to be educated on how to deal with it, like legally and rightfully. And then there are so many organizations. When I was preparing for this webinar, I came up with like a list of a lot of organizations that are doing things in like different like areas to help and support like victims of rape and all that. So I'll share that later, or I'll send it to you by message to share with everyone. But like there are a lot of people who are helping legally, there are a lot of people who are helping psychologically, there are a lot of people who are helping in every different area, because a lot more people are speaking now. According to statistics, 1 in every 4 ladies suffer sexual abuse, 1 in every 10 guys suffer sexual abuse, and it is really an endemic. So people are knowing about it, but people need to know what to do, not just to know how bad it is, but to know what to do. I can provide like some immediate like psychological buffers, not necessarily like solutions, but buffers, things to know to do for your personal like mental health when you experience some of like the triggers and all. But like so for instance, like researching about rape, I found that like there are 4 laws that apply to different states in the country concerning like criminalizing like the rape act, and a lot of people don't know this, especially like in my experience. So people need to know, people need to be educated, people need to be aware. So I would just give the solutions of what people can do, like when they face like traumatic experiences in the moment, like what they can do. So for instance, if one thing that I would deeply encourage is people need to speak out. You need to talk about what's happening, because of like, just like every normal human being, when you go through like a bad situation, it is 10 times exaggerated when it stays in your mind. So talking about it to someone else actually helps you to demystify of some sort what you're going through, and just bring it to a place where your mind can actually wrap itself around it. So talking to people about it, especially people you trust, because as we've known from this rape culture, a lot of people stigmatize, shame, and do so many things. So not everybody, talking to everybody does not really work, but talking to people, who you trust. When you're experiencing like extreme stress, panic attacks, anxiety disorders, you need to do things like go to a place that is safe for you. Even if it means like leaving the place, go to a place that's safe for you. Try to regulate your breathing, because it actually affects you physically. And well, because I feel like a lot of people have other things to say. So there's like so much to do. I would share my recommendations with you, and then you can share it with the people later on after the, but I must also just say that there are so many things that people need to be educated about, and everybody needs to see this in a 360-degree bird-eye view, not just like one solution. Like we need to combine as many possible solutions together so that we can really, really deal with this endemic.
Yeah, thank you very much, Eva, for your elaboration on the fact that education is key. I see a comment from Beauty Jaffet about if religious bodies can use, since the number of psychologists and the population may not be proportionate to each other. And I think that that's a very useful comment. We can explore every opportunity we have. That's why even schools have counseling sessions for students where they just um, brief them generally on the necessary things that they need to do to ensure that they stay safe from being raped, or they don't rape, and even when they're raped, they let them know what next they're supposed to do.
I'm
Thank you
sorry,
so much.
Murna. I would just say that that comment is really helpful, and according to like research for sub-Saharan Africa, is actually more effective for us to use like religious leaders and traditional leaders to intervene. But the truth is that they need to be educated, like psychologically, they need to be giving like mental health special treatment, so they can identify and they can offer like proper solutions. But this mixed integrated use of both the traditional and religious leaders with professionals can actually really help, because a lot of people listen to them, more often than they do other people.
Yeah, all right. Thank you so much. I see a lot of people buying into that idea from the chat. Okay, thank you. Dr. Salma, with okay, what I wanted to ask about some health organizations that provide care for rape victims. Well, I think you could send that so that would add to what Eva has for us, and then we'll share with people that have participated. However, I would like you to just brief us a bit. When a rape victim presents himself or herself to the hospital, what is being done exactly to aid the health of the victim after being reported here?
Okay, so first of all, when a patient presents to the hospital, a rape survivor, we say, when they present to the hospital, we don't just approach them like we do with regular patients. First of all, you have to make sure that you receive the patient well. The usually hospital setting that is supposed to be ideal is that you should have a consultation room that is private, quiet, clean. These rooms should have a latrine or a toilet, and it should have screens and covers so that there is privacy for the survivor, where the person feels comfortable and no one can actually overhear or see the conversation going on. And you should make sure that the room is not too obvious. It doesn't look too obvious. People don't get to know that, okay, this is the reason why you're going into that room. And then the healthcare focuses on survivor-centered care, which is like, you know, when someone goes through rape, there is something that's taken away from them, which is their autonomy. You see, that power you have, it's yanked away from you. So you try to focus and try to give that power back to the person. You give back that autonomy. So when facing rape victims, when rape survivors, sorry, when they're being handled in the hospital, usually they have the full autonomy to make decisions, either to accept or to reject any medical service at any point in time. So the patient, when she's I'm using the female pronoun because most of the times it's the females that present to the hospital. So when they do present, you see the healthcare provider listens carefully, and there is confidentiality. The person is being informed that whatever she says, whatever she tells the healthcare provider, it's confidential. And even if he needs to share the information with other people, she would be asked first before the information is being shared. Then she is counseled appropriately that, okay, this is what has happened. And the next time it occurs, this is what you should do. You should come earlier than you did. You shouldn't take a bath. You should do this and that. There are various advices given. But first and foremost, before any examination is carried out, before any procedure is carried out, there is informed consent that is taken. It's been signed by the patient. Before any examination is conducted on her, she has to sign that informed consent, agreeing that, okay, I am ready to undergo this procedure. Usually, people prefer a female doctor consulting them, and in settings where a female is not available, if the male has to review the patient, then he should have a female chaperone with him. And then we have some centers that have specialized skilled individuals called the sexual assault forensic examiners or the sexual assault forensic nurses. These people are trained and they are skilled with the examination properly. They know how to, they have the special rape kit, which comprises of, I would explain it later on. So the steps that are carried out when a person presents to the hospital, first of all, putting in mind all that I said above, the confidentiality, listening carefully, the autonomy. First and foremost, the first step is the immediate care. If the patient presents to the hospital, if she's injured or bleeding, you know, you first have to, we first attend to that. You stop the bleeding. If there is injury in the private area that needs suturing, that needs attending, you do that first. Then a careful history is being taken. This history is asking the patient, the survivor, questions about what drugs they are on, like routine medications, do they have any pre-existing conditions, what their sexual history is. Some of the questions can get a little bit personal, but they are really important to determine areas where injuries have occurred and to also know the areas that the DNA can be collected, DNA evidence. And then the next thing that's done is the examination. So the patient has the right to refuse the examination, or at any point if the examination is going on and the survivor feels uncomfortable, they can stop it right there, and that's it. So it is very important for a survivor to present to the hospital early, within the time frame of 72 hours, which is roughly 3 days. This is because within that period, the person has 3 benefits. You can, within that period, when you present, especially for the females, when you present to the hospital, there is you can be able to prevent unwanted pregnancies, prevent STI, mainly the HIV transmission, and then DNA evidences can be collected and sent to the criminal lab. So the patient, when they present within 72 hours, those forensic examinations are being carried out. And then we have a detailed physical examination that's also carried out to see injuries. Sometimes these victims are brutally injured. You have some coming with broken ribs. So you have to, we do the detailed physical examination to identify all those forms of injuries. The physical examination also, sometimes we can take pictures to for record purposes. You have sometimes examination of the mouth, the genitals, the anus, all for documentation purposes. The examinations don't usually take much time, and after the examination, the patient undergoes some investigations. You have blood tests that are being carried out. You have samples taken from the urine. You have swab. Usually the swab is taken from the genital area to check for STIs, that's the sexually transmitted infections. Blood samples are taken for investigations. You can do the pregnancy test. All this depends on when the survivor presents to the hospital. If the survivor presents early, some infections are already tackled, and some of the tests don't have to be carried out. But when they present late, there are additional investigations that have to be done. So you take some blood samples are being taken to test for HIV, to test for hepatitis, to check for, we take swabs to check for the chlamydia, to check for gonorrhea, and then the survivor is given medications like an analgesic, which is a pain medication, because most at times they present in pain. Some of them present they have anxiety, they are restless. So sometimes they are given medications that help them to calm down. And then some of them, you see, for those that present early, that's within the 72-hour time frame, we give them the post-exposure prophylaxis, which is for HIV, and you place them immediately the present, and also we place them on the emergency contraceptive to prevent pregnancy. And if the person hasn't been vaccinated against hepatitis, the vaccine is being provided. And sometimes for those that present at a later stage, we give them the tetanus shot, because sometimes those incidents occurs very roughly. They're exposed to things that could cause that, so you have to cover up everything. Even the sexually transmitted infections, most at times in these centers, because some centers don't even have the culture medium to identify these sexually transmitted infections. So most at times, people are just giving medications to just assume that they have it, so that it's better to just cure it in case they do have it. So after that, we it depends now on the clinician. If they feel that the survivor is doing good, they place them on the medication, and then a follow-up date is scheduled. But if they need further management, they can refer them to the psychologist, and then further, or to take legal actions. I mentioned something about the rape kit, sorry. It's very important I talk about it, because most of our facilities here don't usually have the rape kits. which makes the work a lot easier because it has so many things inside it that makes the assessment quick. You see, the rape kits, it's usually called, it can also be called the sexual assault forensic evidence kit. It contains a huge paper upon which the survivor can take off the clothing, take off things from the body, and then any hair or fiber can fall on it, and then it's collected and taken for forensic evaluation. You also have the comb inside it where you can take the hair samples. You have the bottles for the urine sample, the blood sample. You have a detailed explanation for someone, even if you aren't skilled, even if you're just a regular health practitioner, there's a detailed explanation on the procedures to be carried out. So it's also found in the rape kits. You have a paper bag to collect the clothing of the survivor to take to the lab for further investigations. So the rape kit is really, really essential, and it's really needed in our emergency units for proper patient management. So when a patient is scheduled for follow-up, they have to present, because most of the times when they are placed on medications for the sexually transmitted infections, especially HIV, even if you're on the medication, you have to keep coming back to be retested at least on 2 to 3 occasions to confirm that you don't have the infection. So that's a summary of what you expect to get when you present to the hospital.
Yeah, thank you so much, Dr. Salmah. That's more than elaborate. It's not just the hospital and also healthcare. All right. So so from the comment section, I see Zakai Ibrahim.
Okay, can I come on the national?
Hello, please can you mute your mic if you're not speaking? Okay, Zakai Ibrahim has suggested that the government takes the issue of rehabilitation and correction of these culprits seriously, as much as we're trying to help the rape survivors. The rapists also need to be rehabilitated seriously, not just be kept in the prisons. So thank you so much, all the panelists. We've really gone far in all our discussions. I see we've answered a lot of questions that have been coming up in the comments. So, Mr. Arinze, I'll move to you now. So, you've mentioned some strategies earlier, but I'd like to know what strategies exist now based on the mandate of NAPTI. What strategies are there in place to help prohibit rape in the nation, to help prevent rape in Nigeria?
No, I didn't quite get that. Please, can you repeat, please?
Yeah, I'm asking what strategies are there in place now to prohibit rape in Nigeria?
Well, the laws are there, but that is not enough. The penalties are there. That is not enough. Taking it away and now placed it squarely in the violence against persons. But of late, because of the spike in this incidents, this criminal incident, there's a lot of activity found in the corridors of the state governors, all trying to adopt the violence against domestic violence.
Your network is quite bad.
And I wish they'd done that. No time is late. So the and Lagos State, though things can do that. But beyond that, here you go. Can you hear me?
Yeah, but the network keeps cracking. Can you please join in again? So maybe the connection will be better.
Let me try.
All right. All right. So while we wait, Kennedy Shaiyen, can you brief us a little bit about consent? So there seems to be misconception on what amounts to consent in different places, maybe not just Nigeria, but we don't really know what consent is. What is consent?
So, can you hear me now? Are you happy?
Okay, Mr. Arinde is back. Okay, let me get back to you on that question. All right.
Okay.
Okay, so what I was saying is that, so beyond all the efforts by the state government to adopt domesticated violence against persons, we also want them to set up in our structures on their ground. But in the list, the very bulwark of defense for protection of the girl child and the protection of victims of anybody being a victim is in the family. But unfortunately, we found out that women and mothers are not doing enough. You know, there are a lot of women society, there are a lot of women organizations in Nigeria. How much have they done to actually escalate these things to the point that every woman in the society, every woman in their group knows that this is what's happening? You know, because like now, let's take for example issues of violence against persons, child abuse and whatever. The greatest culprits that we found in our list are women, and that is so wrong. We found issues whereby something happens to a girl child. It is mother that says, no, let's not report this because it's a cousin that raped, or it's a cousin that violated, or it's an uncle that did that. So these are the obstacles we must have to remove before we even begin to make any kind of advancement by way of progress in this regard. Only very few, but fortunately and thankfully, the people are now responding. People are now breaking out of their shell. The cycle of silence is being broken, and people are now coming out to.
Hello, we've lost you.
This is what happened, and these are they are both. Can you hear me?
Yeah, we can hear you now.
Yeah, so what NAPTIP is doing is that we're increasing advocacy, we're increasing sensitization and awareness to all the necessary stakeholders. You know, unfortunately, COVID-19 is here. So ordinarily, we are planning to see how we can get all the commissioners of women affairs to begin to force their state assembly members. And the DG, by the time we're done with this, is writing letters to the state assemblies, the speakers, to pursue as a matter of urgency the domestication of the Violence Against Persons Act in their state, so that we can move up this and increase the penalties if it's not there, so long as the people serve as a deterrent. And we've moved further, where now she had met with the director of the Executive Secretary of Human Rights Commission, the IG of Police. The idea is to let us centralize our data, so that anytime at the press of fingerprint or actually offenses. So that's basically our concern now. And also, we also have the short code. That's a *627#, where you can dial it and send an SMS on that issue for issues of sexual abuse or sexual offenses or rape. So those things are there. The sexual offender register is up and running. It's up and running. So that anybody can access NAPTIP, and you can see the names that are there with their pictures and who they are, so that you don't fall prey when people come and say they need any kind of assistance. You know them and track them, and you know them for what they are. So we are shaming and naming now.
Yeah, Mr. Arinde, can you state the code again so that people can hear, and then we can write it to
the short code?
Yes.
Yeah, the short code is *627#. *627, yeah.
627#. All right, thank you. Okay. All right, thank you very much.
Yeah, *627#. Or you call NAPTIP on 1,000. Okay.
Yeah, we're waiting for the number.
Okay, the number is 070 30,203. Yes.
All right, 07030000203. That's the number. All right, thank you very much, Mr. Arizu.
20. Thank you.
All right. Okay, so Kennedy, Shaiyen, back to you on consent. What is consent?
Well, consent is permission for something to happen or an agreement to do something. Now, relating it to the topic at hand, it has to be an agreement between two consenting adults. A child, a minor below the age of 18 cannot give consent for sex. They are below age. So anything that has to do with a child below 18, anything that has to do with a child below 18, you cannot say any sexual intercourse between, no, any rape or sexual assault between an adult male and a child below 18 cannot be considered as consensual sex. No, because that child cannot give consent. Now, when there is an adult, a lady above 18, and say you're in a room or whatever, and she says no, she has not consented to any form of sexual advances from you. The word is no. If she says no, it is no. If she consents and she agrees, mutually there's an agreement that yes, okay, we have agreed. There's permission to do something and there's an agreement for something to happen. Without that, it's just rape.
Wow. All right. Thank you so much. Mrs. Eva, I don't know if you can tell us if consent is feasible in our community.
If consent is
based on Kennedy's definition.
Okay, I would just add to that. Consent also is if, for instance, the person gives consent, right? And somewhere along the way, the person takes back that consent. Yeah. It ought to be honored. So for instance, according to the law also, people who have mental conditions they are not able to give consent because they don't know what they're doing. Yes. Anything that has to do with force, abuse of power, threatened, a threat to hurt, a threat to either take something away from them, either a promotion or a job or something, all these things are what they call it. All these things are considered according to law as reasons for rape. So consent is when the person verbally says no. Consent is when even the person's actions clearly state that they do not want to be involved in this. For instance, for cases where it happens domestically, like maybe with an uncle or something or a cousin, you know, because sometimes because of the familiarity of the person, because they know the person, they are hesitant sometimes because they don't understand, they're unsure. But any form of refusal is the person saying no. And you, whoever the other party is, you must understand that you have no right to anybody's body. You have no right to sex from anybody except they give their explicit consent. And explicit consent means that they have agreed, they understand what they are doing, they understand the ramifications, and they've agreed to it. So that's consent. A lot of people, a lot of like the rapists, right, they capitalize on technicalities to say that the person agreed. So one common one is what they call date rape. Like maybe you go to the club or you go hanging out and you are drunk and they use the excuse of being drunk or unaware of what's happening to take advantage of someone else. Date rape is actually a thing and is actually punishable by law as long as there's no consent. Some people use, even forced consent is not consent. So some people use abuse of power to try and demand consent from these people to perpetrate the act. Forced consent, that's if you threaten somebody's life, you threaten their livelihood, you threaten their economy, you threaten their source of income for these things is actually also not consent. How possible is this in Nigeria? Well, as long as you have a voice and you can say no, it's possible to deny consent. And anybody who abuses that right has abused it by law and is liable to face the full wrath of the law.
All right. Thank you very much.
Let me add one more point, please.
All right, go ahead, Kennedy.
Even demanding for sex before you help someone. If you have the power to help someone and then you have to demand for sex to help someone and the person is helpless, that's rape. Because the person doesn't have a choice. You haven't given the person a choice. That is rape. So you should also know that.
All right, thank you very much.
Yeah, Murna, can I come in here?
Yes, Mr. Rizzi, please go ahead.
Yeah, there's also, because in totality, what the last two speakers have said is that we not to classify them under abuse of authority, abuse of vulnerability, and abuse of trust. You know, you abuse trust when somebody trusts you, like a pastor, and then anything you do because I trust you and you take advantage, that is abuse of trust, and that is rape. You see, you meet a girl and there's a storm coming, you know, because you cannot run away from this. It's okay, hop in the car and I'll give you a ride along my way. You branch in somewhere because you cannot see. You've abused a position of vulnerability. A girl who is, you know, is in a dire straits, doesn't have money, just like the last speaker mentioned, wants a job and you take advantage of that. That is rape. That is rape. I'm not even talking about minors now. You know, I'm happy the last speaker mentioned that if anybody below the age of 18 cannot consent, they can't consent. There's no prima facie of consent. It can't even happen. That's statutory.
Yeah.
Okay, so that is what people do: abuse of position of authority, abuse of position of trust, abuse of vulnerability of person. The person is vulnerable because he found himself in a state that he has no control over. Hunger, you know, crisis, and internally displaced people. You rape them just because you can, and the person cannot do anything. That is rape.
All right. Thank you very much to all our panelists. Okay, from the comment section, Eva has sent a list of things that can help individuals who have been raped. So I'll just read them real quick. First, she says, to take care of yourself, you need to read about rape so that you can see and research and know what it involves. And she's recommending, I'll just read out the website, rainn.org. So you can go there to read about rape. Secondly, you need to try to anticipate and prepare for triggers. So we know what the world has listed for us as causes of rape. If we know this, we should be aware. As much as those are not the real causes of rape, if they are triggers, we should be aware and stay clear of them. 3, we need to pay attention to our body danger signals. Sometimes when danger is coming, you feel it somehow. So pay attention to all those. When the road is too silent and you're hearing something in the bush, it could be a snake or it could be a rapist. So just beware. Take immediate steps to self-soothe yourself. Steady your breathing, watch comedy, or call a friend when you've been raped and you feel sad and lonely. There's always someone that's out there looking out for your own interest. Okay, Shadrach also from the comment section mentioned that we must inculcate morals in individuals in the society through frequent media campaigns or through webinars like this that have been made public so that people can listen and also learn from them. All right. Dr. Salmah, I would like to ask, you highlighted a lot of medical care that's given to rape survivors. How affordable are these services in Nigeria here?
Okay. So ideally, in an ideal situation, for most at times developed countries, like let's say the United States, they have the Violence Against Women Act, which provides the sexual assault forensic examination for free. It doesn't cost a thing to the survivor. This assessment is done free, and the forensic evidence is taken and examined freely. But here in Nigeria, most centers just have limited facilities that carry out these investigations. We don't. Most of the centers don't even have the ability to carry out the DNA investigation to identify which who is the real perpetrator. You know, in a case of rape. So most at times we just have to go to some of the crude methods to just try and confirm that, okay, it is true she has been raped, but we don't really know who did it. So most at times some centers just carry out investigations that just identify the semen in the genital area, and then they just give prophylaxis based on the reports, based on what you say, that, okay, I have been raped and this is it. They just give treatments, but we don't have much measures that can confirm it. And that is a problem. I think that is the main problem that happens, that these people are not being able to be brought to justice. So these services come at a cost to the survivor, because if there were appropriate measures, appropriate policies that were being enacted in place, you know, put in place for these people, and is actually implemented, it would reduce the cost that comes to the survivor, because you have to be sent to investigations. You see, sometimes trying to even screen for the sexually transmitted infections, some centers don't even have the culture medium to identify that, oh, you have an STI. They just have to give you the drug, assuming that you have contacted it. So sometimes not much detailed investigation is even carried out. It's just the patients are just treated as, with the assumption that, okay, she might get pregnant, we give her something to avoid the pregnancy. She might get an infection, we give something to avoid that. You know, just the end product. So much isn't given into investigation. So it's just for an average Nigerian, it's I would say it isn't too costly, but we could do better.
All right. Okay. Thank you very much. Okay. She would still send the list of hospitals that rape victims can access
Yes.
for healthcare. All right. Thank you very much. So I can see Sagir Mahmuda. He's already talking about our next question. He says we must also make the public understand that not only the female gender are victims of rape. In rape cases where both victims and suspects are of the male gender. So, Eva, before you run to leave us, you throw some light on this. So people are arguing men also get raped. How true is this?
Oh
Or
yes,
what can
it's very, very true. It happens a lot. Even men get raped by men get raped by women, right? In fact, it's actually it happens more often than we actually think. I mentioned earlier that 1 in every 10 boys has experienced sexual abuse. That is a high statistic. Even though it's 1 in every 4 girls under the age of 18, it's actually 1 in every 10 boys. So it actually happens to both women and men. And they face the same kind of threats as well. So according to actually research, the perpetrators of rape are usually not as attracted to the victim sexually as many people will say, maybe because of how you dressed or how you're looking. They actually prey on people who are vulnerable. in all the regards that we have talked about on this group. And the statistics also show that people who have raped someone are repeat offenders. Okay, so it's not like something overcame them and it happened. It is an actual intentional act that was done by someone. Okay, so men get raped more often than we like to think or like to believe because of some of the moral etiquettes that we like to hold on to as a community, right? So men get raped by men, men get raped by women, women get raped by women, and women get raped by men. So
Okay, so as much as this is true, how balanced is access to post-rape services for both male and female?
okay, first of all, like the services are not even adequate. So let's just put that out in the open and then put it aside. So I think that because of like awareness and stuff, people are more likely to believe that a woman was raped than a man was raped. Do you understand? Especially when physical abuse happens within the home. So they are more likely to believe that it happened to a woman than they are likely to believe that it happened to a man, which is really, really unfortunate. So even though we are just as a like society just coming into this place where people can now speak out generally about rape, we also need to grow in such a way that men and boys can actually come out and speak about these hideous things that are being done to them. And you know, how we can create like safe environments where they can talk without being like shut up, without being covered, especially when these perpetrators are people who are influential and people who are in power, and it just feels like they are untouchable. And I think that in the law we need to set some examples, a precedent that other people can follow, because if you can show that nobody is above the law, then I think that it will cause some form of like deterrent to people who who think that they can do this and get away with it. So it is obviously not balanced, because first of all, just the notion, like you can see in the debates that people have, or if you throw the question out online, just the notion that it can happen to boys sometimes can seem like impossible. But yes, it does happen, and yes, they are more likely not to be believed.
All right. Okay. Thank you very much, Eva. So
Uh,
we have
Can,
another.
so,
Hello. Yeah.
hello?
Yes, sir.
Yeah, just to quickly, let me make an intervention, a very quick one here. You see, the point is that, yes, like the agency enforcing it, we are aware that boys get abused, boys get raped, but you see, not just the statistics, that does not discountenance the fact that these things happen in the homes. As a young man, I was abused by our house help living with us. But the number, it is not being done, it's not being seen compared to what's happening to girls now. And these things happen. The other issue is that we keep saying parents have a responsibility to protect everybody, you know, both the boy, the girl. The girl child they are weaker, you know, they don't know, many of them do not know how to protect themselves. And I think the next question would be, why is it on the increase? It's on the increase because every young person now is carrying about Android phones. With Android phones, they can access all manner of visuals and all manner of pictures, pornography, which increases entitlement syndrome and makes them access all manner of provocative materials, and they want to experience them and they want to try them out. And that is why, where do they try them out? Young girls. We begin to make excuses, which is wearing a mini skirt, is showing part of her body. You know, but all these things are excuses. Boys get abused. I was a victim growing up, you know, living in my own parents' house, you know, with the girl the girl that was supposed to be minding us. But it didn't change the fact that the greatest number of people being abused is the female child, is the girl child living in their homes.
Thank you very much, Mr. Arinze. Kennedy, you have a question directed at you. What if you have a case where people below 18 agree to have sex? From your definition of consent, you clearly stated that people under 18 should not even be allowed. But here we have a question. What if an 18-year-old wants and gives her consent, or his consent, now that we're for both sexes? What do
Well,
you
like I think I did mention, I said anybody 18 and below cannot give consent because they do not really know what it is they are consenting to. Now, some are actually exposed to certain things before they get to 18, and then it doesn't, and then okay, they tend to say, okay, the perpetrator would want to say, okay, let's do this. And the child might say, okay, but because he was already violated, doesn't really give you the right to go on with that. So a child is a child. 18 and below is a child. They cannot, by law, cannot give consent to anything. Even in the case of marriage, there has to be their parents giving them out, of which I think it's been challenged now. Child marriages, it's been challenged. So you cannot say they give consent. Do they know what they're consenting to? Do they fully understand what they're consenting to? And then the question is not so clear. Is it an 18-year-old with an older person or two 18-year-olds?
Okay. All right. Thank you very much, Kennedy. Kennedy is saying once you're yes, you are 18,
It's an
you can.
18-year-old with an older person, 18-year-olds.
Okay. All right. Thank you very much, Kennedy. So, Mr. Arinze, I would like to ask you this legal part. Beauty Japheth is asking, is pepper spray allowed in Nigeria? Is it legal? Because some other countries have legalized its use, like in the UK. So in Nigeria, can you use your pepper spray when you're trying to be defensive? Okay. Hello, Barrister Judith, are you on the call?
Yeah, on the pepper spray.
Okay, hold on, please, Kennedy. Is Judith on the call? All right, Kennedy, please, could you answer for pepper spray? Mr. Arinze
Okay.
is not.
Well, I don't know of the legality, but I know by law, self-defense is not a crime. If you know someone is about to harm you and you defend yourself, in this case using pepper spray, I don't think there's anything wrong with that, except if you use it without any harm coming your way. But if there's actual harm coming your way and you feel threatened and you use it, I don't think there's anything wrong. It's just self-defense.
Okay, thank you. Dr. Salmah, do you have anything to say about use of pepper spray?
Well, I also I agree with Kennedy because it goes in the spirit of self-defense, and I think it's quite less when you compare it to some of the other things that could be used as self-defense. You know, the effect of it goes away. It's just temporarily. It just gives you like time ahead of the perpetrator. You can be able to escape. You can be able to get away. So I don't think, but maybe we should hear the legal part of it.
Sorry, I didn't get that.
Hello, did you get me?
No, I didn't get the last thing you said. Sorry.
No, I said based on what I think it's the effect of it isn't much compared to some of the other things that could be used in self-defense. I think the pepper spray, the effect is just temporarily. It's just to give you time ahead of the perpetrator for you to be able to get away. And but I don't know the legal standing of it. That's what maybe we should wait to hear from.
Okay, Mr. Arinze, are you back online? We need to hear the legal standing on the use of pepper.
Yeah, I'm back online. I lost you at the moment.
Okay. So
No,
do I go back?
Can you get me the question? I didn't hear what was.
So someone is asking if use of pepper spray is legal in Nigeria.
Use of what?
Pepper spray. So countries like the UK
Pepper
have
spray?
pepper
Hello?
spray. Yes, spraying pepper on the rapist.
For what now?
So everybody is gunning for self-defense. If someone attempts to rape you and you are able to use a pepper spray and spray, the rapist has to take care of themselves before considering you. So what do you have to say?
Please, your sanctity and your chastity is your right to defend by any means possible.
Okay.
Yes.
So
it's your right to defend it by any means possible. So long as it's a rapist, please. But the moment you do that, run as much as God has any ground, because you're a woman and you're a lady, you're a girl, you can't stand the assailant. So anything to deter the animal from getting close to you, you are very free to do that, so long as it has laid his filthy hands on you.
Yeah. Okay. Thank you very much. So we have permission from NAPTI. You can use anything.
Please use.
To keep yourself free or to keep yourself safe. All right. Thank you very much. We have spent a lot of time. So we'll go to hear final words. We've heard a lot of how we can take care of ourselves psychologically, health-wise, and even how we can seek justice. We have gotten some short codes that we can use to reach out to NAPTIC whenever we are under attack. So just for those who are just joining in, *627# is your short code, and you can call on 070-30-000-203, and you're sure that someone would answer and run to your aid. So we'd like to have final words from the panel. Final words of encouragement to rape victims. You've said some along the line during the whole discussion, but what else, apart from being a professional, from your heart of hearts, what do you have to say to rape survivors, to people who are vulnerable to rape? So we'll start with Dr. Salmah, please.
Okay, so in conclusion, what I would want to say to rape survivors or people who are at risk of getting raped is, I think what is very vital and important for us to keep note of is that speak up. I think we're way past the era where you could keep quiet and you're scared of stigmatization. A lot of people are scared of what the society would say, if they would actually get justice or not. Now we have various organizations that would actually they could keep you anonymous, they could fight it for you, and you would get the justice. So I think it's very important for people to speak up. It's very important for people to know what to do immediately. You see, from the medical standpoint, you should know that immediately you get raped, you should present to the hospital within 72 hours. And that is very, very important because of that. The DNA evidence gotten during that time is the gold standard. It's what is going to help you prosecute the perpetrator. It's what's going to help make your case, because it's your word against theirs. So it's very, very important to know what to do first. You speak up, you get to the hospital on time, and not be afraid of the stigma and the usual things that deter us from seeking help. And one thing I would like to urge, I don't know, someone listening, that we really don't have the ideal equipment and testing kits to help these victims. So it would be really nice if they would have confidence in the healthcare system, knowing that if I do report and if I do expose myself, that I am a victim, I have been raped, that something can be done about it, not just them seeing the perpetrator walking about freely simply because your healthcare providers or the system can't prove that this is the person who has done this heinous act. So I think if we have the facilities and the equipment that could prove these things, then people would be ready and willing to, present themselves early because they know that they will get justice and they know that it will be proven. So basically, that's what I have to say.
All right. Thank you very much, Dr. Salma. So, Eva, could you give us your final words of encouragement in 2 minutes?
Okay, I would say that for everything that has been said, people should pay attention to it. It's just not one of those normal talks. Like every time you get the ability or the opportunity to get information about this, you should take the information. But I want to say that much more than just taking the information, pass these learnings across. A lot of people fall victims because they don't know, and those who are victims, they don't know what to do about it. So as much as you learn, educate the people around you, educate your cousins, educate your siblings, educate the people in your neighborhood, educate as many people as possible. And if somebody tells you that something has happened to them, believe them first before you start to scare them, because once you show any judgment or you show any doubts, they will immediately close up and not be able to reveal what has happened. So especially now that we have a lot of child abuse, if you have a little cousin or anyone comes to tell you that this person touched me inappropriately, or this person did this, pay attention to what they're saying. Children don't just wake up and lie about something as grievous as this. Pay attention to what they're saying. Listen. Try, before anything bad happens, educate them from a tender age. Start teaching young children about what this is. If you see this, if this is happening, talk to somebody, report it, this, that. Sometimes you just believe that children are too little to know these things or understand, but they do understand and they listen and they hear. So education, like we've said repeatedly over the course of this panel, is important. And if you're always waiting for government or some high-standing organization to do the education for you, that's a wrong approach. Learn by yourself and then be the instrument to teach somebody else about this.
All right, thank you so much. I like your emphasis on education. Sex education is really important, as well as educating people to know what they should do next. Self-education is also important. So please, every information that we've gotten, especially the one to check out RAIDD.org, is important so that you know what to do for yourself. All right, Kennedy Shaiyen, could you give us your last words?
Okay, to survivors of rape, I first of all want to let them know that it was not your fault. It wasn't your fault. You're not at fault. You shouldn't feel guilty. You shouldn't feel embarrassed, as painful as it is. And then, as much as difficult as it is to open up, you do need to open up. Talk to someone. And I know once you've been through that, it's difficult to trust anybody or anybody at all, but you just have to trust someone, because your silence is one of the reasons why the perpetrators of this evil actually have to forget to escape the law or the crimes they have committed. So my plea to survivors is, please know that it's not your fault and you need to open up. And then to it can be embarrassing. I don't know why you see it as embarrassing, but it can be somehow to the family that, okay, this is the family of the girl that was the person that did this
Kennedy, your network is quite bad. So we'll move to Mr. Arinze. Mr. Arinze, can we have your last word?
You shouldn't do this to another person's child. So do not strike in so much pain alone, because the trauma of that. Okay. Can you? Hello?
Hello, Kennedy. We can hear you now.
Okay, you can hear me now.
Can I come in now?
We can hear you now, Kennedy.
Okay. So to the parents of survivors, please, as much as
Okay, Kennedy, your network is proving difficult and we have limited time. So Mr. Arinze, please go ahead.
First of all, attack your child or say what, unlike it's bad. Okay.
Okay, just say that a rapist is worse than an animal, and it has no moral rectitude, can shamelessly deprive another person, especially the girl child, of their God-given rights of protecting the chastity and sanctity of their body and mind. And is all allowed to pollute such sanctity and their sanctity. There's no respect of mandates. Let me address parents, especially parents and mothers. As much as we spend time, because we live in a patriarchal society, to prepare the girl child for their role as mothers, let us also prepare sons for their role as fathers. Parents, when you buy phones for your children, check what sites they visit. Phones are primarily to make call, others are added values. Check what they do, what sites they visit. That's how you break the cycle of entitlement syndrome. They don't be children, lots of children are consuming pornography, and that's why we are where we are. Do you know what your children do behind closed doors? Do you monitor them? Do you check them? Are you too busy to have time for them? So as much as we train the girl child on sex education, boys also need to know that they shouldn't have entitlement syndrome, and no remains no. No does not have any other definition than NO. It is not possible, it is not allowed, and you're not going to do that. So please let us be mindful of this. Thank you.
All right, thank you so much. No means no. We need to educate ourselves. Parents, please check whatever your children are watching. And for rape survivors, it is not your fault. It's not your fault. It's not what you wore. It is not your fault in any way. All you need to do is focus on yourself, focus on your health, get health care. Go to the hospital and get health care. We have psychologists that are ready and are always willing to help you forget or help you out of some of the traumas that you faced. And Mr. Arinze, we hope you take our request to the government, since you're here, the only link we have to upgrade the kind of justice that rape victims seek for themselves. So thank you everybody for joining us. Thank you so much for your comments, for your questions. We hope that we've been able to meet some of them or all of them. And after now, we're going to forward a summary of a summary note of everything that we've discussed, with a list of organizations that we can access for rape care that Eva has sent us. We'll send the names of hospitals that Dr. Salmah has listed for us that can provide health care for people that have been raped. So thank you for joining us. Please feel free to email any of the panelists if you still have some questions, or you can reach out to Plan International to help debunk some mysteries that you still find around the rape issues. Thank you so much, all our panelists, and we apologize to those who were unable to join due to some technical issues. So thank you, everyone, and have a wonderful day.